All right. Hey, welcome everyone to our advocacy update. Understanding. Oh, sorry, I got a black lab barking in the background, but isn't that taking us back to COVID and Zoom? Hold on, just a second. I'm going to mute for 1 second so I can yell at my husband. This is too funny, you guys. This black lab is going nuts. So anyway, understanding the impact of our recent state and federal legislation on biohealth companies. So first I'm going to introduce Jordan Lamb, our phenomenal legislative counsel. I'm going to give her a little bio. I don't normally read bios, but in this case I am. So Jordan has over 2 decades of experience representing a diverse set of clients before the Wisconsin State Legislature and state agencies. She is a Madison native, and she graduated from the University of Wisconsin and also the University of Wisconsin Law School. She spent 20 years in private law practice serving government relations clients and developed a strong background in environmental and administrative law. Jordan is highly skilled at legislative planning and legislative analysis. Okay, that's her bio. But now this is how I would say it. Jordan has done an extraordinary job representing BioForward and our biohealth industry for 18 years. She truly is an asset for us and our member companies. She's responsive. She is admired and respected in the Capitol by both parties. And a comment that someone made to me last week was, "Oh, Jordan is great!" Exclamation point, exclamation point. We stand out versus many other states and in a positive way. Jordan now works as a principal at the Welch Group. The Welch Group is a full-service government affairs and association management firm specializing in providing a broad suite of impactful services. Their bipartisan government affairs team supports direct lobbying, strategic planning, crisis communications, PAC and conduit administration, and issue management. We can go to the next slide then. So the agenda for this webinar is we're going to overview our state issues and go into detail on the successes that we achieved. I'll go through some of just a kind of a short list of federal legislative issues that I think are most critical. And at the end, then happy to take any questions from any of you. And you can put those in the chat and I will ask Jordan those kinds of questions. And if it's on the federal level, I will try to answer them. Okay. Next slide. So overview of state issues, and then we'll go into the next slide where Jordan's going to talk and go into more detail. We're really excited about our successes this summer through one legislation and then through the budget, increased R&D tax credit, refundability from 15% to 25%. There goes my black lab again. Elimination of personal property tax. And then what we're working on, all co-pays count legislation, coverage of breast cancer screenings by health insurance policies, and increased funding UW system. And with that, I'm going to hand it over to Jordan, and then we'll see if her little dog barks, but it's probably going to be better than my black lab that keeps barking. So here we are back in the Zoom world of dogs and kids. So get away, Jordan, on the next slide.
Thank you, Lisa. I really appreciate that really kind introduction. And today I'm in my downtown office, but we do have a dog here. One of my coworkers has a, but she doesn't bark. I hope now that I've said that, Norma will make an appearance, our Welch Group dog. But I am downtown, right across the street from the Wisconsin State Capitol. That's where I've been doing this job for over 20 years now, and for 18 years representing what is now BioForward. And in the odd numbered years, so Wisconsin has almost a full-time legislature. We are in session 18 months out of every 24 about. It changes a little bit. They might adjourn a little bit early in some years and stay a little longer in others. So the session begins in January of every odd numbered year. So January 2023 was the beginning of this legislative session. The first 6 months of every legislative session are dominated by the budget bill. So Wisconsin passes one giant appropriations bill that dictates state spending for in 2-year increments, biennial budget. So it spends money for 2 years, and our fiscal year runs from July 1, 2023, and then it ends in June 30th, 2025. Those are the 2 years, from July 1 to June 30th, 2023 to 24, and then 24 to 25. So this budget bill contained a couple of provisions that were good for all businesses, but in particular, good for our Wisconsin biohealth businesses. So the Wisconsin has a research credit for increasing research. When it was created with a 10% refundability provision. It was increased over the years up to 15%, and BioForward worked with a large business coalition for the first 6 months of this year to increase the refundability portion of this research tax credit for our businesses. And Lisa will get to why that's so important for our businesses in a minute, but I'll just kind of give you the overview. So the governor was even more friendly to us and proposed a refundability portion of this tax credit of 50%. The finance committee, when they came in and worked it out, reduced that to 25%, but that reduction is still a 10% increase from what we had before. So beginning in tax year 2024, our companies can claim up to 25% refundability of the research tax credit in Wisconsin. That was signed as a part of the 23-25 biennial budget bill, and it will start for this tax year. It is, like I said, important for Wisconsin's business. So we participated a lot. Lisa spent one whole day in the Capitol just talking about this and about the economic impact of biohealth in Wisconsin and why this refundability increase was so important. Lisa, do you want to kind of give that part of the story?
Yeah, and just the things that we really highlighted with the legislators was by doing this, especially the refundability and for our smaller companies, there's companies that don't have tax liabilities. So just to get an R&D tax credit also is not as beneficial as a refundable R&D tax credit. And certainly we had already had a refundable, as Jordan said. We just felt, and to stay competitive with other states, we needed to continue to increase this refundability percent. So this really encourages, and a lot of these statements, I went directly to one of our member companies and what does this really mean to you? And it really does encourage further R&D investments. And again, that was part of our pitch to legislators at how critical that is for the future of Wisconsin. It reduces certainly the income tax expense for our companies. And then it even encourages non-R&D investment and cash savings because of getting this money back and again, trying to really increase the R&D that our companies can put in. This is where the state is really trying to help this industry and many industries. So what was great, it was really across key industries in Wisconsin came together to really try to fight for this. So it does make us, again, more competitive with other states, new R&D investment, and in our opinion, it even advances innovation. Anytime you're increasing R&D, then what's going to come out of that is hopefully new technologies, new innovation that we can take to commercialization. So a really good win and a lot of hard work by Jordan and a lot of companies to make this happen. Next.
Yeah, next slide. The second business issue that we worked on in this budget bill, and it wasn't exactly in the budget bill, but kind of, that part is kind of an interesting story. This is, I think, the third session we have worked with another very large business coalition to try to completely eliminate the personal property tax in Wisconsin. So the personal property tax has existed in Wisconsin since the 1830s, and it was a way to collect tax revenue on in areas where you weren't seeing lots of sales of goods and services, but people owned things, and so they taxed their property. But it's translated into a very piecemeal. Some jurisdictions have it, some don't. Some municipalities enforce it and collect it, and some don't. But for some small businesses, it can be a very expensive local tax. So this coalition, we kind of chipped away at it over the years, but this session completed a complete elimination of personal property taxes in Wisconsin. They'll take effect January 1st, 2024. It has a $174 million effect on small business across the state, so it is not insignificant. It will eliminate that burden of trying to report and pay to your local municipality. And it also encourages investment in new equipment and assets, which is another thing that our businesses tend to have a lot of equipment. So the repeal was actually accomplished as a part of the shared revenue plan that the legislature adopted. It was a separate act from the budget, and then included in the budget was sort of one-time funding to help municipalities make them whole for the first year of the repeal, so that they have time to adjust their local budgets for the repeal of the tax. But again, I think, and I'll let Lisa kind of fill in the commentary, this is just another way to help small and large businesses have more money to put back into the business.
That's exactly what I was going to say, Jordan. I was going to make sure we also said it doesn't really matter on the size, right? And I really liked what this controller said, just this even less administrative burden. That's not just the money coming back, just the manpower, what has to go into both of the, and I shouldn't say both, but for this one, and then for both of them, it's really putting that cash back into companies and then they can reinvest back into their own company. So I think that's where, just this combination is just really strong. And we were just really excited to share that this is what BioForward, and this is why we have Jordan, is that we're fighting for our companies to make sure that we're benefiting you so that you can then reinvest into your companies and continue to grow in the state of Wisconsin.
So that leaves us, so now we're in the remaining probably 6 to 9 months of the legislative session. I don't know, maybe not that long. They might leave a little bit early this year, but we'll see. And we have a couple of remaining issues. I'm going to actually kind of go from the bottom of this slide up. I didn't really pay attention to the order when I was making them, but funding for UW-Madison, the UW system, was something that we didn't get much of, or as much of as we wanted, in the biennial budget bill. So these issues remain kind of hanging out there for the rest of the session. I mean, the budget did fund some capital projects at UW system schools. So I know the UW Eau Claire Health Sciences building project was funded. That's something that we were supportive of in the budget bill. But the UW-Madison Engineering School building was not funded in the budget bill. And we strongly support the renovation of the engineering school. I think it's about a $350 million project. They've done all of the planning. We understand what is needed. It is needed. It would allow UW-Madison to increase their engineering enrollment by additional 500 students. Our association is very connected to workforce issues. And one of the strongest links for our very educated workforce needs is our very strong University of Wisconsin-Madison and UW system. So we work a lot with their legislative team to try to support their initiatives. This engineering school building is very important to other industry sectors as well. There's quite a large group business coalition that is working to continually talk with the legislature about possibly coming back and funding this outside of the budget bill. There's a number of university and UW system specific projects that you may see, hopefully, introduced as separate legislation to be considered, debated, and hopefully funded before the legislature adjourns in 2024. Lisa, do you want to talk about the engineering school and how closely we are connected to that as a workforce generator?
Yeah, I mean, it's why we focus, and that's even certainly our arguments to any legislators that have had concerns over this is not about just academics, right? This is a critical workforce that we are hearing repeatedly from our companies, is the need for engineers, and that to be able to attract some of the best young talent that's coming through, we need to be competing against Illinois and Michigan and Pennsylvania, all of those that are continuing to invest in engineering because they see the future. Purdue has put in tons of money. So this is one of the reasons that we're backing both the university and then specifically the School of Engineering. Our companies are speaking up, and this is a workforce issue. So hopefully something positive will happen in the near future. But yeah, I think that's it.
And then, that's sort of a broad across, sort of a general workforce development issue. And then we have specific pieces of legislation that are aimed at supporting innovation and using additional technologies. And that's what this coverage of breast cancer screenings bill is sort of about from our perspective. I mean, it is an insurance bill because the legislation would require health insurance policies to provide coverage for supplemental breast cancer screening and advanced diagnostic tests for certain patients who have increased risk of breast cancer, or those who have abnormal mammograms. And it's kind of shocking actually to learn that isn't covered even when you do have those. Because under current law, insurance policies have to cover 2 mammograms to screen for breast cancer for women ages 45 to 49 if you meet certain requirements, and then annually starting at 50 years old. That's the law in Wisconsin as it is. So this is the second session that this bill's been proposed. It always has a pretty favorable public hearing from the public. It is, of course, not supported by the Alliance of Health Insurers. They tend to generally oppose legislation that dictates what has to be covered or how much they can charge for things that are covered, but we support it because I think that this definitely supports what we see as when innovation is moving forward and you have a way to detect and protect human health in a new way, particularly in this way, it should be incorporated as something that can be covered under health insurance in Wisconsin. So that's what that is. That's what Senate Bill 121 and Assembly Bill 117 are. We'll see. It's kind of stalled. It had a very good hearing in the Senate. We'll see if it moves yet this fall. One of the biggest issues, though, that we have spent a lot of time on starting last session, but it's really dominated our legislative agenda this session was copay accumulator legislation, or a copay maximizer prohibition. So it's introduced as Senate Bill 100 and Assembly Bill 103. This legislation would prohibit health insurers in Wisconsin from including a copay accumulator or a copay maximizer in their policies. We have seen this adopted already in the last 2.5 to 3 years, 19 states and Puerto Rico and the District of Columbia. If you don't know what this is, so copay accumulator, I'll just give you a little bit of an overview, is a feature of an insurance plan whereby the manufacturer's copay assistance, so the part that the manufacturer is giving to the patient to help them afford their medications. You can see that on some of the ads during the Packer game tonight. I'm sure you'll see one. If you cannot afford your medication, contact manufacturer and they will help you. They're directing patients to a program called patient assistance, copay assistance, where the manufacturer is helping them meet their copay obligations so that they can get their medication that's been prescribed for them and that is already covered by their insurance, their health insurance. It's not telling their health insurance to cover it, it's already there. What the health plans have done when they include provisions called a copay accumulator is they'll take the patient's money and the copay assistant money at the pharmacy counter toward the patient's copay amount and give them their prescription back. But behind the scenes, the only part of that payment that's being counted toward the patient's out-of-pocket maximum or their deductible is the part the patient paid, not the money that came from the copay assistance. And at some point, you get to the end where you show up at the pharmacy counter as a patient and you haven't met your deductible. And all of a sudden you're responsible for that full amount. When you thought you had been chipping away at your deductible the whole time, every time you fill that prescription, at some point it does run out. So basically it's saying that the only part that counts toward their deductible is the part paid by the patient. The manufacturer's copay assistance doesn't accumulate toward the patient's deductible. That's where the term copay accumulator comes from. So anyway, the legislation would prohibit that in Wisconsin. We are not leading this by any means. There is a massive coalition of patient groups from everything from multiple sclerosis, hemophilia, rheumatoid arthritis, the American Cancer Society. All of those patient advocacy groups are really leading this effort because this is something that directly affects patients at the pharmacy counter, but we are absolutely supporting them in their effort. It is our manufacturers that were asked to help patients afford their medication. They do that through this program, and then the patients aren't necessarily seeing the benefit of it when they have features of their hidden. They are hard to find, honestly. I don't think hidden is an exaggeration in their health insurance contract that says we'll take the money, but we're not going to count it toward what you owe us in your deductible. So we have spent a ton of time working with our friends on the patient advocacy groups to try to get this legislation passed this session. It's going to take a lot more to get it passed. They do have a website. I think it's called Wisconsin. Well, I'll have to look up the website and put it in the chat if you want to see. They have really fantastic patient stories, video stories that explain the issue. We had a really, really well-attended press conference, but what we need now is a public hearing. So we are trying to work on the committee chairs in both of the houses to hold a public hearing on this bill so that the patient stories can come out maybe, and we can get a little momentum behind this. As you can imagine, it is very, very much opposed by health insurance companies. They don't like this legislation. So we'll see. We have a couple months left. The coalition is very impressively strong. We have had really good help, I think, on the social media side, on earned media. I think we're up to like 56 co-sponsors. Thank you, Dee, for putting the wisconsinforpatients.com website in the chat. That's our website. And if you get a chance to look at those videos, this is this website has worked really well for us on issues like this in the past, where we have patients themselves tell their story and explain how this prohibition is affecting them and their health. We used this in the past when we had to deal with some legislation restricting research in Wisconsin. So we picked up the model and are using it again with our copay coalition. So hopefully we can all be talking about this next spring as a success. But right now it is just sort of an ongoing legislative battle that we're fighting to support our pharmaceutical manufacturers and what they're offering for assistance to the patients that need their medication. So that's really a summary of what we've got going on the state level. What is on the next slide? Do we switch to federal now? Yes. Okay. Federal. Now we switch to federal, and this is Lisa's part. All right.
I'll go through this quickly. So BioForward, there are a few state associations in the nation that do have federal lobbyists. BioForward is not one of those, but we do work closely with the Biotechnology Innovation Organization, which is BIO. Most people know of that large national association. And then we also work with AvaMed, who represents the medical device industry. I really come in then as far as just working then directly with our congressmen, and our senators, and just going directly then to those offices when issues come up, and then we either want them supporting something or we don't want them supporting something. So the first one is one that this is the one we've really concentrated on because it seems to have had the most impact against our small companies. I think when it was brought out by Congress, and I think it was the summer, June maybe, of 2022, and what they did is for R&D expenditures, you always could deduct, amortize that the year that it was incurred. And that legislation that was put through last year then forced them to go over 5 years. No matter the company size, it forced them to go over 5 years. Well, this really hurt a lot of young companies that all of a sudden couldn't have all those R&D expenditures to take them to reduce then their taxable income, and many times wouldn't have taxable income, then it created taxable income. So although I think Congress probably thought they were going against larger companies, who it had the most impact was on our very small companies, our emerging growth companies. So we've really been fighting. There is a lot of bipartisan support. Senator Baldwin certainly has been great on this, and Congressman Pocan, but also even in like Glenn Grothman has signed on. And so they're working through this legislation, trying to get it passed. There's a couple different legislation, but the Small Business Jobs Act, it has gone through the House Ways and Means Committee. But I think, as we all know right now, I don't think anything's really going to happen in Congress. I think they have their hands full right now, just refinancing our government. So there's no, I haven't seen any other big updates right now. It's still pending. Nothing has kind of moved on with this, and as many things have just not moved on recently. The second one, the Medicare Multi-Cancer Early Detection Screening Coverage Act. A company like Exact Sciences, this definitely impacts them. There is a bill pending, again, a lot of bipartisan support, and it certainly focuses on cancer. And the issue that they're having right now is that when Medicare covers those, it's, I guess, maybe more for even the seniors, that the FDA approves it, but then it doesn't, CMS then doesn't take this on until many years later to get this screening. So they want simultaneous kind of approval that once the FDA approves, it should immediately be evaluated by CMS to be able to get these screenings, again, especially to senior groups, out as fast as possible, rather than these year-long delays. And it will actually, will save many, many lives by getting this passed. So there has been a lot of progress recently, and again, very bipartisan on this initiative. So hopefully things will keep moving on this. The fight chronic diseases, it really is just, it's a partnership to urge the Centers for Medicare and Medicaid to reconsider its national coverage decision, requiring coverage with evidence development for an entire class of Alzheimer's disease therapies. There's a lot of issues right now with, I think, questioning some of these Alzheimer's drugs, which should continue to come out and benefit patients. So it's really trying to prevent Congress from not allowing those therapies to be able to be, again, more for seniors, obviously, but trying to get this out and keep these moving forward and not preventing access to these critical drugs for those that are suffering from Alzheimer's. And if anyone has ever had that in your family's lives like I have, it's vitally important to keep pushing and having access to these Alzheimer's drugs. The Pandemic for All Hazards Preparedness Act, just again, trying to get prepared if the pandemic or bio threats happen in the future. It's just trying to prove and getting these incentives, having and promoting the research for this. So it's kind of a multi-stage act that has a lot of different things in it, and with like a national stockpile of drugs and just all kinds of things that trying to support to get us ready, which we all hope doesn't happen again. But if another thing like COVID does happen, really being prepared for that and not waiting. So that's kind of just a short one. We do, if you want to go to the next slide, Macy, we do have all of this on our website, both federal, state. We have our government affairs committee up. The other thing that we have in our advocacy area is our economic impact reports. We do come out with those every 2 years. The data is critically important. We use this in our EDA Tech Hub proposal. It was critical to have this kind of data, and it can be very helpful to our companies anytime you're trying to use it. And if you do any advocacy yourself, it's very beneficial to have data. And we even have what's showing on this screen is a policymaker's kit that just summarizes, since our economic impact report is quite lengthy, it puts it down into just a few pages for legislators. So please don't hesitate to use these resources. And again, stay tuned to our website that we try to keep updated so that you know what we're actively working on and any news that might be coming through. And at the bottom of the page, it even talks about who's on our Senate and Assembly committees for our state. And then also, if you can look up your legislators by your address, you can go in and see who is serving you in the Assembly and the Senate. Not on the more on the federal, this is all on the state side. So that is all on our website if you ever need more information. And then I think that's it. And then it was just if anyone had any questions for us. Doesn't look like it because the chat, I think, was just D, right?
Yep, she's got our
And
website in there.
Yes. Yep.
The coalition website, I should say.
Coalition, right. And if not, like I said, things are on our website. People can contact myself if they need more information. And if they hear of anything, if there's any other concerns and you know of something either on a federal or state, I do get contacted on the federal. Certainly I heard a lot, as I said, on the R&D amortization on a federal level I heard from many companies on that to be fighting for that. And that's great. And that's very helpful. And then keeping them updated on our efforts then around those areas. Happy to do that. And so the same with the state. If there's anything that comes up.
Please don't hesitate to let us know or ask questions if you have a question about something that comes up too.
And I think there's no other questions. I think that's it. I want to thank Jordan for, again, being the best legislative counsel you could possibly have. She serves our industry well. She's so knowledgeable. And she's just a real asset for all of us. And I thank her again for everything that she's done. And it's a great working partnership that we have. We have a lot of fun. She doesn't always have a lot of fun in the Capitol, but she's tough. She's tough and can handle it. So again, we appreciate it. Thank you, Jordan, for taking the time, and thanks for people for joining in.
Yes, thank you everyone for joining it. We appreciate it.
All right.
All right.
Bye.